Sounds great. Welcome, everybody. My name is Marty Mascuri, and I am a contractor under the North Central Texas Council of Governments for the Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, or ADRC. Both of them are programs for the greater Dallas-Fort Worth, Texas area. Although we know many of you joining us are from different areas of the state or even outside the state. And welcome, welcome, welcome. You're always welcome to join us. We love to have you. And we also love to have the people in our service area, of course, as well. We're here this morning with with my partners at the Area Agency on Aging and with our partners at the Better Business Bureau to talk about Medicare, midweek Medicare, what's new in 2006, and phishing and phone scams. And I know that we are in the middle of open enrollment, so it is a tough time for them, and so we appreciate them all being here to do this today, because they are, I know, just slammed this time of year trying to help people as they're working through open enrollment. So those of you that are joining us for CEUs, I want to go over that, and then I'm going to turn it over to Leslie with the Area Agency on Aging to get us started. But for those of you that are joining us for CEUs, we're offering CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process and get a certificate and submit it to your jurisdiction to see if they might accept it. I've had many people tell me they've been able to use them for license other than these two in Texas. I've had people tell me they've been able to use them outside of Texas. I've even been approached by other licensing jurisdictions asking me for more information about a webinar we've done in order to see if it's met the threshold for what they're looking for CEUs for their people. And so you're more than welcome to get their certificate and submit it to them. But just know there's no guarantee that they'll take it. We're also offering certificates of attendance to anyone who'd like to have one. Today's webinar is worth 1.5 hours of CEU credits. You must complete the entire live webinar and the Q&A until 11:30. I realize some of you have commitments at 11:30. You've marked this out. Sometimes the Q&A goes a little longer than 11:30, but if you're just fine if you log out at 11:30. If you need to go on, that's not going to affect you getting your CEUs, but you've got to be on for the whole webinar. You must also complete the Google evaluation survey form. That should pop up as you close out of Zoom today. It should ask you if you would like to take a short survey, and it will take you to our Google evaluation survey when you click on that. If your computer doesn't allow you to do that, and some people that work for big companies, I know that computers won't allow them to access those pop-ups. No worry, the survey will be sent out to you in a follow-up email tomorrow. And it says today, but it will be tomorrow that will go out. And the Google survey will be up for a week till a week from tomorrow. And then give us about a month to get those certificates out to you. In fact, I'm running a little bit farther, even longer than that right now. I was out of town for a month and a half, and it's really difficult to do the certificates if I'm not at my desktop, so I'm having to catch up. So I'm going to turn it over to Leslie Kilton, and Leslie, it's all yours.
Well, great. Okay. Well, hello to everybody. Let me get started sharing my screen here, and hope I can pick the right screen, right? Let's see here. How does that look?
It looks perfect.
All right, great. Well, I am excited to be here to share. This is always exciting to know what's happening the next year for Medicare. And so today we're going to be talking about what new things are coming up. I am Leslie Kilton, and I work for the North Central Texas Area Agency on Aging, along with my coworkers Simon, sorry, Dolores doesn't hear anymore, Felicia and Melinda. And then I want to tell you that we are a SHIP center, which is the State Health Insurance Assistance Program, even though there's no A in SHIP, but whatever. And we are funded by the U.S. Administration for Community Living and at the U.S. Department of Health and Human Services. And here's what we can do. We can help you understand your costs and your coverage. We can compare your options. We can enroll you or change your plans, and we can help with correct billing issues. There's more we do too. So here's how you find us, because there is a SHIP center in every state. You can call them or go to shiphelp.org. Then we have 54 SHIPs, one in every state: Puerto Rico, Guam, DC, and the U.S. Virgin Islands, 22 local programs, 12,000 counselors, 12,500 counselors, and we educate 7 million people, and we have 2.5 million counseling sessions. So there we are. Okay, and our services here at the Area Agency on Aging, we have a lot of services for older adults, and we have services for caregivers of those older adults. So we are worth checking out. It's always good to call and see if we have something we can offer or be of service in some way. We also have services for people of all disabilities. That is the Aging and Disability Resource Center. That's ADRC. And again, they have services for caregiver people of all ages too. So we also want you to volunteer. We have a lot of volunteers, and we love our volunteers. They are instrumental. It's always a good thing to volunteer, because you get trained the same way we get trained. And then you can go out in the community and know more than everybody else. That's always fun. And then, so if you are interested in volunteering, becoming either an SMP volunteer, senior Medicare patrol, or a benefit counselor volunteer, and you just call Sharon Rowbottom and she'll help you get set up. Here's some more information. This is what we have volunteers for: benefit counseling, senior Medicare patrol, long-term care ombudsman, and taking control of your health evidence-based programs. And they help you manage your chronic conditions and reduce the risk of falls. So that's all fun things to do, and you get to go out and meet people. So here are some more information about the volunteers. We serve the 14 county region in North Central Texas. You get training, and you have background verification. You get continuing education. And here's Sharon's phone number if you're interested. It's a wonderful thing. And we've had volunteers forever. They have been with us for years. So, and they're very active. Okay, so here we go. This is our 2026 Medicare updates. Are you ready? So right now, we're going to talk about the annual enrollment period. We're going to talk about the Inflation Reduction Act, the 2026 prescription drug plan, the Medicare prescription payment plan, programs to help with drug costs, and what the increases are for the deductibles, co-insurance, and premiums. All right, then right now we're in the annual enrollment period. It starts October 15th and goes through December 7th. This is the time that you can change from one Medicare Advantage plan to another. Now, we know that there are two paths to Medicare. One is like traditional Medicare, which is with Part A for hospitals, Part B for doctors, Part D, the drug plan for prescription drugs, and then a Medigap plan. At this time, we can only change your drug plan if you're in that category, if you go that path. If you go to the Medicare Advantage plan, then your drugs are rolled into the Medicare Advantage plan. And now is the time to look for a new plan or just see what's out there. You can just compare, make sure that you still are in the plan that fits you best. All right, so you can enroll in a Medicare Advantage plan, you can change your plan, and you can go from Medicare Advantage to traditional Medicare, which you then have to enroll in a Part D plan. Then you can change your Part D plan if that's what you have. And they all will be effective on January 1st of next year. And this is all on Medicare.gov. And then the Affordable Care Act insurance, the marketplace, that's for people who are not on Medicare. So you would not look there. Okay. So now we're going to talk about a little bit of scams because everybody knows that it's a Medicare enrollment. And I'm sure everybody's been getting tons of contacts from people wanting you to buy their insurance and telling you all these great things. So just here are some tips. There are no limited time offers. You have until December 7th. If it's too good to be true, don't do it. Agents. I'm not an agent. I am a benefit counselor. We don't profit. We don't make any commission or anything. But the agents do, but they're not allowed to cold call you. Okay. I guess they can cold mail you because they are mailing stuff out. But and be careful of the ads on TV. They sound really good. And sometimes they're not all that they say they are. And then review the plan before you switch. And then always review your current plan to make sure it covers your doctors. And that is a new feature of the Medicare Plan Finder. They have a place where you can add in up to five of your doctors. So they then see if they just show you the plans. Well, they don't, they show you everybody, but you can see if your doctor is on that plan. That saves you a little bit of legwork. But once again, it's a computer. And so if you see your doctor on there and you think you want to switch to that plan, just call the doctor's office and just do a double check. You know, I guess they are having a little bit of issues. And so they are going to do, I think they're going to have some kind of special enrollment. So if you got into the wrong plan, you may be able to change after it's all said and done. So at least that's what I've been reading. So, all right, now we're going to talk about this Inflation Reduction Act of 2022. So this has been going on for a couple years now. So Medicare can negotiate with drug manufacturers for the price of the Part D and Part B drugs. So a Part B drug is if you go into the doctor's office or have it done as an injection kind of thing. That's who would pay for that type of drug. Then this year, in 2025, we capped the drugs for the first time at $2,000, but next year they'll be capped at $2,100. That means your out-of-pocket expenses, once you reach it, once it reaches $2,100, then there won't be any more copays. Everything will be at zero cost. And here are the drugs that are on this Inflation Reduction Act, because these are expensive drugs. So we have Eliquis, Xarelto, Januvia, Jardiance, Enbrel, Imbruvica, Farxiga, Entresto, Stelara, and then this is insulin. I don't know, Fiasp and Novolog. Those are coming up this January 1st. Their prices will drop. And then the Inflation Reduction Act also allows for drugs in 2027 and 2028 to be lowered. So there's more coming. I think there's 15 in 2027. And so here's how it works. You have your benefit. The deductible this year in 2025 is $590. Next year, it's going to go up to $615. Not all the Medicare Advantage or the Part D drug plans have to charge that. They can sometimes reduce it. It's up to their discretion. But the most they can charge is $615. And you have a maximum out of pocket of $2,100. Now, next slide's going to tell you what goes into that out of pocket expense. So once you reach it, you don't have to pay any more for covered prescription drugs. And that's the thing. The drug does have to be on the insurance company's formulary. So here's what counts towards the $2,100 limit. Deductibles, the $615 or whatever they're charging. Sometimes it's $300, sometimes it's $600. So that goes towards that cost. And then any co-insurance or co-payments. All right. So that's important, because if you got some really expensive drugs, you could meet this in, the first couple months of the year. And then here's what's not counted. So if you have a premium for your Part D plan, that doesn't go towards it, just the deductible. The premium is a monthly charge for the cost of the plan, and the deductible is, what they're not paying for. Any drugs that are not on your plan's formulary, they won't be included in that. Now, you can always ask for an exemption. You can always ask to say, could you please cover this drug, and see if they'll do it. So you can always ask. And any pharmacy services that are not related to the cost of the drug, like delivery fees. And then if you have another insurance, Medicaid, paying for your part of your drugs, those don't count towards your $2,100. All right. Then there's also, again, this year we started the Medicare prescription plan, and that's going to continue next year. And that's a payment plan. So if you go to the pharmacy and the drug cost is outrageous, you can ask the pharmacist, and I think it goes through your insurance company. So, but they have to do it, and they make it a payment plan over the course of the year. So, okay, that might help some people. All right, now this is a prescription program offered through Social Security, and it is called Extra Help, or the Low Income Subsidy. This is a great plan. It is income based, and here the income levels are here. So what happens is, if you qualify for it, they will pay for your premium if you have one. They will pay for your deductible if you have one. And it's a reduced amount of copay for both generic and brand name drugs. So if you meet it this year, you automatically get it next year. You don't need to reapply. Your annual income has to be below $1,976 monthly for a single person, and $2,664 for a couple. They have the yearly benefits there too. So, but you also have to look at your resources, and resources are, think money in the bank. They don't count your house if you're living in it, but if you're not living in it and you're renting it, then that's a resource. And they don't count in any other income like pensions, so they count that. So it's just your, my mind is gone here. So anyway, so you can only make so much money, and it's worth applying for. And actually, it's on the Social Security website. It's very easy to do, and you should hear relatively soon. With the government shutdown, we're not sure if it was taking longer or not, but it's usually 3 weeks. So now that's opened up, here we go. All right. And we can help you do this too. When I do it for people, I do it right on my computer, and I send it directly to Social Security. It gets submitted to them, and our name has to go on that application as well. So you have some credibility. Okay, so now here are the projected. We don't really have the final costs of everything yet. It's a little too early still. They're still working it out. We do know some things. So for the inpatient hospital deductible, this is for traditional Medicare, Part A, it's going up to $1,716 per benefit period. Now, your Medicare Part A is mostly free as long as you've worked 40 or more quarters for Social Security coverage, right? You paid in for 40 or more quarters, then Part A is free for you. But if you only worked 30 to 39 quarters, then you're going to have to pay $310 a month. And less than 29 or fewer, that's $563 a month. Okay, those are the projected amounts. Okay, so then for the Part B premium, we do know for sure it is going to be $206.50. This year it's $185. So it is going up to $206.50 in January. The annual deductible is $288 a year, and this year it was $257. So it's going up from $257 to $288. But the coinsurance is staying at 20% of the Medicare approved amount. All right. And let's see here. Okay, that's it. So, ooh, that went fast, boy. Does anybody have any questions? Let me see.
There's one in the Q&A, but I haven't looked at it yet. I'm sorry.
Okay.
I've had traditional Medicaid for years. If you look in the Q&A, you'll see a question.
Yeah, I'll get it.
Yeah, Simon's going to do that. So, but if you
Okay.
have, there are resources available, and the resources are visit the Medicare.gov website. You don't have to have an account on Medicare to do a plan finder. It's pretty easy. I mean, it could be overwhelming, and if it is, you can always call us. We'll be happy to help. They have, you can use the you can pick 3 plans to see how they compare to each other. And then within each plan, you can go to all the details to see how your drugs are paid for. It'll show you monthly. It shows you what gets applied to the deductible, and it shows you what your monthly cost would be. So that's good. You can also call 1-800-MEDICARE or us. And then the PAN Foundation is a wonderful organization. So if you have a specific disease or a chronic condition, you could look there to see if they have a grant or some money that would help you with certain things. That's, it's always worth looking at. Then contact us. We're the State Health Insurance Assistance Program. And then you can always enroll in extra help through Social Security or call us to do it for you. The other program too, which is not really on here, is the Medicare Savings Program. That is it's also income-based. The extra help is through Social Security. The Medicare Savings Program is through Texas Health and Human Services. We have our own income guidelines for that. They haven't changed yet, but they will. When the Social Security does their increase, which this year is 2.8%, then a couple months go by and then they raise up the amounts for the incomes for the other stuff. The Medicare Savings Program it's an umbrella program. It has 3 levels, 3 tiers. And the most income you can make for a single person is $1,781. And then if it's a couple, it's $2,400. If you qualify for that, then it pays your Part B premium. This is important because the premium is going up to $206.50, and that's a lot of money. The next level is that first level is called the qualified individual, QI. The next level is the SLMB, specified low income Medicare beneficiary. And it is $1,585 for an individual and $2,135 for a couple. Now, with all these levels, you can only have $11,160 in assets and for a single person and $17,470 for a couple. All right, so you have to remember that you have to fall into that. A lot of times when I'm helping people, I'll say, okay, now do you have any retirement? Oh, no, but I have a rental house. And I'm like, yeah, okay. So there's that. But the final one, and that SLMB pays the Part B premium as well. The final level is called the QMB. I'm sure a lot of us have heard about it. We like to think of it as the Cadillac. It's qualified Medicare beneficiary. And that income for a single person is $1,325 or $1,783 for a couple. that pays your premiums, copays, and deductibles. So it is, you have to have Part A for all of these, um, but it's a wonderful savings, and it really, really helps a lot of people. So that's all good to have. So um, anyway, so there we have it. I know I didn't take very long, so let's have a discussion. Going to be a short um, session this
Well,
time.
Simon's manning the questions, but you might want to answer them live.
Yeah, I can answer
Um,
them live. Let me
when
stop
eligible, well,
sharing.
and Simon's typing the answer right as we speak,
Oh,
right?
okay.
It says, but still, it says when eligibility and income based, do you know if VA benefits are included in the income calculations?
All income, all income. And they don't care how much you owe. They don't care what your bills are. They only want to see your income. So you do have to submit bank statements, a copy of your Social Security award letter to show what your money is. And they do have access, they have your Social Security number, so they do have access to look at all your records.
So,
Okay.
so the VA benefits are included, like you say.
Mm-hmm.
Yeah,
Um,
yes, because it's a form of income
Income.
that individuals get. A lot of individuals do call it like or see it as a benefit, but not. It's a benefit, yes, but that benefit is also a form of income, and they look at almost any kind of form of income that you might get, or in this
Right.
case, the VA benefit.
Mm-hmm.
It's an income, so they will include that with your
Mm-hmm.
Social Security benefits, with your IRA, with savings account that you have. They look at all that, and that's kind of that's the reason that they ask for a bank statement, or actually not only one, but they want the last three bank statements that you've received to send them copies of that, and they look at all of that. So,
And they
and
want, yeah, if they have it, if you have anything that produces income, they want to see it. So
yeah, yeah. So, Jolene
I
Schroeder has a question. Go
I
ahead.
see that. So, well, those are yes. So that's similar to like the Texas teachers retirement, Um, they don't give you a choice. And that plan is not on the plan finder. It is your plan and nobody else. You can't just, not anybody can get into it. You do have the option to change, but once you leave that group, you can't get back in.
yeah,
So you really
that
need
is
to,
correct.
yeah, you really need to be careful because sometimes they offer way better benefits than the rest of us can get, kind of thing. So, um, and no, you don't have to. The next one for Carol Franzen, you don't necessarily have to let them know. They will figure it out when you change. Everybody, they all just figure it out. So, if you have Medicare Advantage and you decide you want to go back to Medicare, or, traditional Medigap plan, you can just sign up for a PDP, a prescription drug plan, an individual one, and it will drop you out of your Medicare Advantage. But before you do that, make sure you can get into a Medigap because when you have a Medicare Advantage plan, you have 12 months. It's a trial period. And if you decide you don't like Medicare Advantage or the 12 months is up, you can go back to Medigap or go to a Medigap plan. But once that 12 months is over, then you're subject to underwriting. So then they want to look at all your pre-existing conditions and your medical records and decide if you're a good risk. Okay. Social Security income for Anissa. The Social Security income is always gross. So the full amount is your income. They don't do it after when they take out the 185 or the 206. It's gross, the full amount. And that sometimes puts people just right over the edge. Can't qualify because of that. But they're taking out this money. But so that's just how it works. So
Very good.
yeah. So there's a lot to know. I will talk a little bit about a Medigap plan, um, because there's some things you should know. One of the things when looking at Medigap plans is they are plan letters. It's so confusing because for some reason they have named all these parts of Medicare the same names, you know? So um, they um, call it, so it's Medicare Part A, that's your hospital insurance. Part B, that's your doctor and outpatient insurance. But with Medigap, it's plan. So they have all these plan A, B, C, and it goes on. There's a nice chart in the book, and we have access to some of that information we can mail out, a book on how to choose a Medigap policy. Um, and within that plan letter, they have to they have to give you the same basic standardized insurance coverage. So if does so you can have in letter G, you can have some plans for $100 and you can have some plans for $500, but they all have to be offer you the same coverage, standardized. I mean,
Smooth
maybe,
and
yeah.
yeah. Sorry.
So,
Can you please make sure you hit Lucy's, because I think this is really important.
okay, let me see. Lucy. Oh, yes. You do not have to enroll with Medicare. Isn't that exciting? Um, and I'll just use myself as an example. So I turned 65 3 months before I started here. And I had Medicare, but I unenrolled from Part B. I still have the Medicare Part A because, and that's optional, but it's no cost to me. So why not? And it is secondary after my group health insurance, but you do not need to enroll in Medicare at all. Um, well, you still have group health insurance. Now, you cannot have a gap. If you have a gap, then they will charge you a penalty. There are some things that are not credible, like Cobra is not credible, except the drug part of it is, but that's another story. But, you know, oh, I'm going to retire and they're going to give me Cobra for 6 months. You have 8 months after leaving your job to sign up. So you could use that and then, but Cobra's expensive. So it might be worth weighing the options or the costs and that kind of thing. Um, so once you leave, everybody leaves their job because you could go on your husband's insurance, your spouse. Um, then you have a certain amount of months. I think it's 6 months when you start your Part B to sign up for a Medigap, but only 3 for Medicare Advantage. And it's only, you got to decide because 63 days to sign up for a Part D plan.
And
Okay.
and it's really, really, really important, I think, that you understand, that you get with somebody and understand, because the penalties aren't a one-time hundred
No,
dollars. The penalties
Correct.
go on for the rest of your
rest,
life.
Correct.
They
yes.
don't just, it's not a one-time, oh well, I just pay the hundred
No,
dollar penalty and I'm done.
no.
It's every single month for the rest of your life. And that's
Yeah, the Part B penalty is 10% and the Part D penalty is 1%. So you
and
really
it's
need to know about these timelines and deadlines.
yeah, yeah. And it goes on, it's 10% every single month,
Yep.
ongoing. It doesn't stop. My mother got caught up in that. I just want to make sure that I make that point. Sorry.
Yeah. So, okay. So will you face that lifetime penalty for not enrolling in Plan D in the beginning? Well, maybe. I mean, I'm not sure how lenient they are. They might have a little bit of a grace period, but if it's been over a year, you know, I did have a woman call me. Her mother was 92 and never got on a drug plan, and I said, I'm not sure it'd be worth it to get on it now, So they've just been paying for her drugs out of pocket, but a lot of people don't know about this drug plan. It's the most recent change, I think, with Medicare. So anyway. Um, okay, what part of Medicare covers home health, hospice, and I think it's Part A. Hospice is under Part A. Even if you have Medicare Advantage, it goes back to Part A. Simon, do you have anything you want to add to that?
Nope, you got it.
Okay.
Does that include the DMA, the durable medical equipment? Is that all Part A too?
Good question,
No, it's not.
Simon.
No,
No, it's Part
Part
B.
B. Part B.
Mhm.
Okay,
Yes.
very good.
And it just depends on what the doctor orders or requests for you.
I
Mhm.
see. I see.
Yeah. So, there's a lot of changes this year. Medicare Advantage, they have reduced the number of plans out there, their choices. And I don't know about you, Simon, but I'm getting a lot of calls where people are wanting to go back to the Medigap, to the original Medicare. See, it is tough because of that underwriting. Also, the thing with that's changed with the Medigap policies is they have 17 procedures that they're going to do a prior authorization for under the Medigap,
Correct.
which they've never done before. So you can look up those. I don't really have a list of them. There's some of them are sort of obscure, but there's still 17 procedures. So definitely things in the insurance world are changing because, we're used to having prior authorization with the Medicare Advantage stuff. So, mhm.
Yeah, Gail adds in the chat
Yeah.
that her friend's husband
Mhm.
had to go through underwriting and didn't qualify to go back, and
Mhm.
that's pretty common. That's why you want to make that decision. Um, really,
Right.
really weigh your options when you're signing up, right?
Right. Well, okay. So if you really want to think about Medigap, there are 3 different types of pricing. That book that we have here really explains it well, or you can find the PDF online. It's How to Choose a Medigap Policy. And the 3 different types of pricing are attained age, which is 99% of all the policies is attained age, but they have issue age and they have community-based
Community pricing. Yeah.
community pricing. So their attained age starts low, but every year you get older and every year the plan increases. And then issue aged and community based may not do it quite as much. They look at, um, they don't care about your age when you join. So but they will increase from inflation sort of thing.
Could you send me the link to that PDF
Yeah,
for
I
that?
will.
And
Mhm.
then just to make sure everybody understands, you can email us in order to get those documents
Mhm.
sent out to you if you want them by
Okay.
mail. You
Right.
just email your mailing address. Is that right, Leslie?
Yes. I can do that. Oh yeah, somebody already put it in there. Look at that.
Yeah, that's very good. Thank you so much.
Thank you. You want a
Yeah,
job? Hey, come and volunteer with us. So
yeah, that's right. I'll include that in that follow-up email for everybody.
and
Um,
then with the state insurance, whether you have Medicare Advantage, you can't have both. You can have one or the other, so you don't need a Medigap. So with Medigap, you're going to pay a premium every month. Medicare Advantage, not necessarily. Um, Medicare, um, Medigap, never. Well, the traditional Medicare does not pay for hearing, vision, or dental. If you want that as an insurance policy, you take out a separate insurance policy, but it's often included in the Medicare Advantage as a perk. And the other thing is the over-the-counter, benefit that they sometimes give people.
Stipend.
That, yeah, they
Yeah, it's
never,
usually stipend. Yeah.
yeah, stipend, whatever. They don't do that with the traditional Medicare, Medigap. They don't do that. So there's some perks to Medicare Advantage. So. The name of the book is How to Choose a Medigap Policy.
and I will send that link out to you.
Mhm.
Is the link the same thing? Is that right?
Yeah,
Did I
it looks like
understand that
it's
right?
right. Yeah.
Yeah, I will send that link out to you. And you've got it right there in the chat if you want to just grab it now. But I'll also include
Mhm,
that in
mhm.
the follow-up email.
It's a great book. I mean, the Medicare and You Handbook does have all this information, but this one for how to choose a Medigap policy is focused just on that. And so it gives it a lot more in depth and it's easier to find. The other book that's good is Understanding Medicare Advantage Policies. So that's plans. That's a good one too. And that's a separate PDF. So it's,
I'll
you
get
know,
you to send me that PDF too, if you would.
I know. I bet Alessandra does.
I bet it's in there. I bet it's in there before we know it. There you go.
We want her to come work with us. Okay.
Yeah. Thank you, Alexandra. Thank you so much
Yeah.
for putting that in there. That's very nice.
So yeah. So anyway, yeah.
Go ahead. Did we get all the questions that I know the Q&A had several more questions. And so
Okay. Once again, the two books are How to Choose a Medigap Policy and Understanding Medicare Advantage Plans. Both of them are online under the PDF, Medicare. They're through the CMS. So you can find them easily. And then, we are actually out of the books right now, but they're in high demand. So, but we can, oh, look at her. All right. Gold star.
thank you.
Thank you. Right.
Thank you. Did you guys get everything in the I don't want to cut into Angel's time, but did you guys get everything all the questions in the Q&A? I got
I think
lost.
so.
We did. It looks like we did. Yeah, the only one that I'm thinking that might not is the one from Jolena Schrader, where she says with the state insurance Medicare Advantage, do they need Medigap? Well, if you're on the Medicare Advantage plan, you cannot get the Medigap
One or the
policy.
other.
Yeah, you can only take advantage of the Medigap policies with original Medicare. When you're on original Medicare with the standalone prescription drug plan, then you can take advantage of the Medigap policy. But if you're on any form of a Medicare Advantage plan, you cannot take advantage of the Medigap policies.
I think that's a real confusion point for people. The difference between Medicare, traditional Medicare, and Medicare Advantage programs. And what I think that's really something that confuses a lot of people. You can, when you originally sign up, and I'm asking this as a question, please. I'm not the expert at all. But when you originally sign up, you sign up for one or the other, correct? I think that's
yes. Two different paths, right?
They're two different paths. You choose. You hit a fork in the road, and you choose what road you're going to take. You're going to go right or you're going to go left. But once you do that, changing back to traditional Medicare requires that you go through an underwriting process, which means you go through a health check and all of that. Is that correct?
Yeah, well, if you haven't had Medicare Advantage for 12 months, if it's been 12 months or less, you can probably easier go back. But once you hit that 12-month and then it's underwriting, if you're healthy and you don't take any drugs, it may not be a problem. So, and
the underwriting means that basically you're applying for Medicare and
Medigap.
I'm not. Well, isn't it the other way if you're going from Medigap back to traditional Medicare?
No, Medicare Advantage back to Medigap.
Back to Medigap. That's when you have to go through underwriting.
Right.
Okay.
So when you turn 65, that's called your initial enrollment period. And they cannot look at your pre-existing conditions at that time. But once you get out of that period and 12 months down the road, if you decide, I'm not sure I'm going to stay here, I want to go back, you better do it before 12 months. And I have a lot of people who are calling after 4 or 5 years. And I'm like, well, you can always try it. They can say no and try several companies and see if anyone's willing to take you. It could be that your premium's higher. So
I think a lot of people don't understand that when they're making that initial decision of the fork in the road, what it means for you down the line, because underwriting to me and you we may understand that because we work with this, but underwriting to them in many cases doesn't mean that, not necessarily something they understand. And it means again that they go look at pre-existing conditions. They go look at your age now. They go look at anything that the drugs you're taking now. They
Right.
look at everything, and then they get to decide whether they want to take you back or not. It's
Right.
not an automatically qualified.
Right.
And that's
And the
really
other
important.
and the other confusing thing is that with Medicare Advantage, you can change every year. So
Yeah.
why can't I do that with Medigap? But it's different. So with Medicare Advantage, we're in an open enrollment period and you can change every single year. And if you're on Medicare savings programs, you can change every month. So anyway, somebody here, Carol, has recommended watching this John Oliver show about the Medicare Advantage plan. It's not so much as the scams. I watched it. It was hysterical and it was factual. So it was interesting. So he's funny.
Okay, send me that, will you?
Oh gosh, it was hysterical. It's on
If some,
YouTube. I'll send
if,
it to you.
if somebody
It's
can send me
not,
that YouTube,
yeah,
go
it's
ahead.
not safe for work. Okay, it's one of those. It's a little, but it's funny.
Okay.
So,
Well,
he's. I don't get to watch him because he's on. Is he on HBO or something? I don't get access to that. But
why don't you send it to me? And if you want it, I won't include it in the follow-up email because I don't want to cross any lines. But
yes,
if you want to, if you would like it, if you send me an email, I'll be happy to
yes.
respond with it
It
too.
was
For
it
you.
was it was very accurate. And we also have a comparison between Medicare Advantage and Medigap. We do have a like a diagram kind of thing. So we can certainly maybe I'll send that to you too.
That'd be helpful.
We have a
And
lot of good helpful.
yeah, that I'll send in that I'll include in the follow-up email. So
Okay, the
let's
clip is she will ask one more question. It's John Oliver talking about Medicare Advantage. So and
okay.
it's on YouTube. So that's
Okay.
all I know. That's as much as I know. So
Well, I think we need to get over to Angel. Is
I
Angel?
know,
Did
and
we lose you,
Angel.
Angel? Are you still there? Can you turn on your audio?
Hello,
There we go.
I am here.
Okay,
I'm here.
hold on. I just want to thank you, Simon and Leslie. Thank you so much. I hope you'll stick with us because I'm sure there's going to be
Oh
more
yeah.
questions. And
Thank you. Great to
but
be
I
here.
didn't want Angel to run out of her time. Thank you so much.
Okay, bye.
No, no worries. I mean, if people are asking questions, I mean, obviously it means people are engaged and that's what we want, right? It's people to be involved. So
Absolutely.
yes, great presentation, Leslie. Thank you so much for your wisdom. You and Simon, I mean, y'all are just wealths of knowledge. So let me go ahead and get my presentation up and running. All right, does that look good on everybody's screen? Y'all see not my notes page?
It looks good.
Yeah, it looks good.
Okay, groovy. So, hi, good morning, everybody. My name is Angel Hansick. I am with the Better Business Bureau Education Foundation's program called the Texas Senior Medicare Patrol. And today we are going to be talking about Don't Take the Bait. Phishing in today's world and all the phone scams that we're seeing, which of course is constantly evolving. But we're going to try and cover as much as we can today and kind of give everybody a base understanding of phishing and spoofing and other things of that nature. So let's go ahead and jump into it. So first off, if you've never heard of the Texas Senior Medicare Patrol before, which I would be surprised because Leslie basically gave a whole spiel for us. But if you've never heard of us before, what we are is we are a federally funded program that covers the entire state of Texas, but we are housed in the Better Business Bureau Education Foundation of Greater Houston. Okay, so we are stationed in Houston, but we go all across the state. And there is a senior Medicare patrol in every single state in the US and all of the United States territories. Okay. And so what we actually do is we are recruiting and training professionals and volunteers on Medicare fraud and abuse so that they can go out in their communities and talk about Medicare fraud so that we can try and reduce the amount of waste that is in the Medicare system. There's a ton of money that's lost every single year to Medicare fraud and abuse. And so our organization is here to try and mitigate some of that loss. And we are also a reporting agency. So you can actually call us completely toll-free, completely confidential, and report any fraud that you may be seeing on your Medicare summary notices in the healthcare setting, so that we can go ahead and build that case and send it to the proper Medicare fraud control units. So that could be, of course, Medicare. We send it over to Medicare, but also local law enforcement, all the way up to the FBI, depending on the type of fraud that it is. So our mission here is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, error, and abuse through outreach, counseling, and education. So a pretty big mouthful to say we talk about Medicare fraud all day, every day. So I will ask for y'all to be a little involved with me today. So really quick in the chat, can y'all tell me some things that scammers want from us? What do scammers want when they are reaching out to us? What are they trying to get? Okay, and first up is money. Yes, 100% they want our money. Okay, so how are they getting our money? What are they asking for? I see social security numbers, access to money. Yes, Kim, that is 100% right. So an alternative form of money, right, is gift cards. And so why do they want gift cards? What is appealing about gift cards to scammers? Exactly. Sandra has gotten it. They are not trackable. They're non-traceable. Thank you, Jose. Yes. If I take your credit card down to the local Walmart and I buy my flat screen TV, you see where that has been spent at. But if I get a prepaid gift card from you and I go and spend that money, it is non-traceable. It is gone with the wind. You don't know where that money is being spent. So that scammer can get away with it. But of course, they still do want your credit card information. They want your bank account information. They want that direct access to your cash. They also want, I heard somebody say, or saw somebody say it, social security number, right? They want to steal your identity. They want to take out loans in your name, right? They want your social security number. They also want your Medicare number. And I saw that a few times in there as well. They want your Medicare number. They want to steal your medical identity and receive payments in your name, services in your name. They want to use up your Medicare benefits, or they want to even steal it and pretend to be a durable medical equipment company, to be a physician, right? And then say that you are receiving services and get money from Medicare. And then they also want information like our date of birth, or the names of our children, or what street we grew up on. What does this sound like? What do the answers to these questions sound like? Things like our pet names, our father's middle name, things like that. Why would they want that information? And I see Kim has said it again. It is security questions. This sounds like our passwords, right? So they may have all this other information about us that we don't realize, and now they just need our password, right? And so they are trying to get information from you. And so they may call you and they may not say, hey, I need your credit card information. Hey, can you confirm your bank account information for me? They may already have that information. Now they need your passwords. So we want to be super, super careful with whatever information we may be sharing over the phone, online, through messengers, right? And Sandra hit the nail on the head. It is easier access to steal your identity. Yes, 100%. Okay, so now we know what they want. How are they getting our information? How are they finding my phone number, my email? How are they getting access to my bank account information? How do they know all this stuff about us? The internet? Yeah. Public record? Yes, yes, absolutely. What about something more old school? Did you know that they are still dumpster diving? Scammers are still going through our trash and looking at our documents that we are throwing away. So I don't know how many people in here are shredding their documents, but you definitely should be. Okay, just because we're moving into more of a high-tech society does not mean that scammers are not still doing things the old-fashioned way, like dumpster diving or shoulder surfing. Okay, so shoulder surfing, what this is we have everything on our phones nowadays. Okay, so we have our bank accounts on there, we have our social security accounts on our phone, right? And whenever we are in a public space and we are typing in passwords to our phone, looking at our bank account information, people can just be looking over our shoulder and seeing that information. Okay, and that seems very low tech, it's very old school, but that is very, very true. And this happens all the time. So be careful what you are accessing in public. Public records, Miss Chastity said it earlier, is yes, public records. Absolutely. A lot of people think that all of our information is very private, it's not accessible, but our property ownership, what vehicles we drive, if we're married, okay, our phone numbers, our email addresses, all of this is public record. It is available online. We are Googleable. Okay, I can Google anybody here and probably find your address, your email, and your phone number pretty quickly. Okay, so just because somebody has our information, just because someone calls us and says, hey, do you still live at this place? And is your last name this? Are you still driving a Toyota Tacoma? Right? Just because they have this sort of information that makes it sound really legitimate, anybody could have that information. Next up is social media. We are sharing a lot of things online that maybe we should not be sharing. A really good example that I like to share with people is whenever you are going on a 2-week vacation, don't put on Facebook, hey, we're leaving, the house is going to be empty for 2 weeks, come rob me, right? We don't want to share that all of our belongings are going to be left unattended while we are out of the country. So we want to share all that information after we get back from Hawaii, right? Then we can post our pictures and say, hey, surprise, I've been gone for so long. And the same thing goes with things like our medical records, right? And our family and things like that. We want to keep some information private on social media. Back during COVID, people were taking pictures of their vaccination cards and putting it on social media, on Facebook, and people were stealing their vaccination cards and actually using that information that was on there. So please be careful what you're putting on social media. Of course, scammers are selling information to other scammers. There is a really high rate. If you are scammed once, there's a very high likelihood that you will be scammed again. I think it's a 1 in 3 chance that you will be rescammed because the information is sold to other scammers. So please, 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 if you have been scammed in the past, lock down your information, go and freeze your credit. Okay, take a lot of steps to try and protect yourself as much as possible. And then finally, we are accidentally sharing a lot of information that we probably shouldn't be, like on social media, right? Or whenever we are getting those scam calls and we may not realize it and we are talking to them, maybe we like to try and get a rise out of scammers. And so we'll sit there on the phone with them for a while and try to get them riled up. I know plenty of people do this. A lot of people's dads do this. This is very much a man thing to do, but anybody does it. And what's happening whenever you're sitting there chatting with them, they are getting information. They may hear that you have a dog barking in the background, right? And so now the next time they call, they may pretend to be the local vet. Okay. Or they may hear children in the back, right? Or any sort of information that they could gather from that phone call. And they are recording our voices, which I'll talk about a little bit later in the presentation. So we don't want to sit there and chat with scammers, answer any calls from people that we may not know. So that brings us into phishing scams. So if you have a cell phone, if you have an email address, you have experienced a phishing scam. I am 100% positive of it. So phishing scams, how it works is you're getting that text message or that email saying, this is the USPS. Your package has been undelivered. Please click here to verify your information. Or you get an email saying, this is Bank of America, please verify your banking information or your account will be shut down. Okay, any sort of thing like this. So how it works is a scammer actually sends out a mass text or email to multiple folks with some sort of line like, this is Amazon, this is the USPS, this is Texas tolls, right? That's been a really big one, is the toll scam. So you'll get this message saying that you need to do something urgently, that you have to pay a fine, that you have to verify your information, you need to change your credit card, anything like that, and there will be a link in that message. And when you click on that link, it will either do one of two things. It'll either take you to a fake website where you can put all your information in, and it looks just like the real thing. It may actually really look like Amazon or really look like the Bank of America login. And you type in all your information there, and you're giving your password to the scammers, and putting your credit card information in, and you're giving it directly to them. Or whenever you click on that link, it will download malware onto your device. Okay, it'll download a virus and then they'll start tracking where you're going, your keystrokes, all of your information, and that's how they will get access to your info. Okay, and so this is called a phishing scam because it is sent out to a bunch of people, right? Let's say everybody on this webinar, I send you a text message saying that your Amazon package is undelivered. But of course, not all of us have bought something from Amazon, recently. Not all of us are expecting something from Amazon. So a lot of us will probably delete that text message and say, this is definitely a scam. But there's probably about 15, 20 people here who have purchased something from Amazon recently. And they will say, oh my gosh, my early Christmas shopping, it needs to be delivered to my house. Let me click on this link and make sure that it gets where it needs to go. Okay, so the scammer has thrown out a line, okay, and now some people might take the bait, okay, just like regular phishing. That's a good way to think about it. So please be suspicious of any sort of text or emails, messages that have this urgency in it, asking for any sort of financial or personal information. If you're getting a text message, and it's from a random number, go ahead and just delete it. If it's an email and you're not sure of the validity, you can actually hover over the email's address, okay, and actually see where it's coming from. So it may say Angel Hanzik has sent you an email, but whenever you hover over that actual domain, the email domain, it may say 12345@gmail.com. Okay, this is not a legitimate email address. I'm not going to be emailing you at 12345@gmail.com, and neither is Amazon or Bank of America or Medicare. Okay, anything that has a strong sense of urgency, demanding anything, you have to get it done in the next 24 hours. This is a huge red flag. And then, of course, we're not going to be responding to any text messages from these unknown numbers. Texting them back and saying, do not text this number again, is not going to do you any favors. They're just going to see that this is a live line. This is a person that they can interact with, and they're going to keep sending you messages. Okay, so please do not respond to any text messages. So we are actually going to do a little exercise here together. And so this is an example of a phishing email. And I want y'all to go into the chat and say, what are some red flags that we are seeing? What here makes you think that this is not a legitimate email from Walmart about our order? Okay, we have some people saying the spelling, Walmart is spelled wrong. Yes, there's 2 L's in this Walmart. Okay, so misspellings is a very, very common red flag for a phishing email. Okay, I'm seeing a bunch of stuff. Yes, the urgency. We have to update our address, and if it's not received in the next 48 hours, we will get a reduced amount of money back. Okay, so we have that urgency here. Okay, we also have it's impersonal. Okay, it says, "Dear client." It doesn't have my name. Yes, it doesn't have my name. It doesn't say, "Hello, dear Angel, your order number here." It says, "Dear client." Okay. Address is misspelled. You are advised to update your address or reply us. Okay, we have a misspelling and we have bad grammar here. This doesn't make a lot of sense. Okay, an address is wrong again. And somebody said it here. Happy day. Walmart is wishing you happy day. So this is a very terribly worded email. It's hard to keep track of. So this is a huge red flag. We know that this is a scam and we are going to just go ahead and delete this, not click on that link, not update our address, nothing. Okay, we have another example here. We have some text messages. One is from Chase, our bank, right? And then the other is from Netflix. Please take a second, read over this and see if you see any red flags here. I don't see anything in the chat yet about these text messages. So let's see, first up, we have dear client again, right? We have this impersonality here where we're not being very personal. It's not dear Angel. So it could be for anybody. It's just copy and paste it. Okay, we have that link that is asking us to click here so that we can reactivate our banking services. And the link is not to Chase Bank, right? It's https://tinyurl.com YCLLH, right? This seems very suspicious here. And then people, of course, are saying violation is misspelled. The grammar is a mess, 100%. Here we have no space between necessary and information, and instead we have a period, right? It's huge grammatical issues. Next, over on the other text message from Netflix, we were is both capitalized, right? Grammar issues. We will charge you, okay? So once again, we have all capital letters, and then there's that urgency. We'll charge you again in the next couple of days. If we are not too able to. So it's a little hard to read through. It's hard to understand. The grammar is awful. Oh, excuse me. So here we have a ton of red flags that y'all are very easily able to see, and tons more, right? If I was to circle everything in here, the whole thing would be covered in red.
Angel, let me ask you something about that, if I could. If you
Yeah.
can back up real quick. You look at the URL address on the second one, and it says www.netflix.com. And so you would want to, how would you deviate that there was a problem with that? Because and I don't know if it's misspelled. I guess it is misspelled, isn't it?
Yeah, it is, but that's the thing, is it makes you think
Yeah.
that it's spelled correctly at first glance, right?
Yeah,
We
at first
typically
glance.
only register the first 2 or 3 letters of a
Yeah.
word, and then we kind of move on.
Yeah, because at first glance it looked like it was, and I caught that after I asked the question, but it's really important that and they're getting better and better at it all the time. Thank you.
Yes, yeah, no, exactly. And they may put a 1 in instead of an L, right? So then you can barely even see the difference. But that was a great example, right? It tricks your mind thinking, okay, this looks legitimate. So we really have to scrutinize things before clicking on or utilizing any sort of links. Okay, and I think this is our last example here. So go ahead, look over this and tell me y'all's red flags that y'all are seeing. Okay, the email address. Yes. Okay, it says it's from Microsoft Office 365 team. But then the actual email address is a mess. Okay, CYH11241 at whatever this is, right? So there's no way that Microsoft is going to be emailing us from such a mess of an email domain. Okay. Here we have detected spam messages from email appear here. Okay, so again, this is a template that wasn't even fully filled out. So it didn't even have our actual email address in it. Okay, so this is another red flag. We have that link there, verify now. We need you to click on here. So there's that suspicious link, okay, as well as some urgency there. And then here we have in our signing off, in our signature, Microsoft Office 365 team exclamation point. Okay, so this is a mess, right? We're not going to sign off as Microsoft Office 365 team. The grammar is a mess. We have our blue underline here where we have verify space period. This is very obviously a phishing email. Yes, the urgency to respond. Thank you, everybody. The blank to section. So whenever we are getting any sort of emails and we're not sure of their validity, the best case scenario, the best thing that you should do, the best practice is to go ahead and go directly to the source. We don't know if there is an issue with our Microsoft 365 email, so we're going to go directly to Microsoft.com. Okay, we're not going to click on any links here. We're going to go straight to the source. Or if we have that text message from our bank saying that there's some sort of issue with our account, we're not going to click on the link in there. We're not going to call a phone number that's in that text message. Instead, we're going to call the number that's on the back of our bank card or log in directly to our bank account from our phones or on our computers. Okay, that's the best thing that you can do is go directly to your app, call the number from your source, from a separate source, not from what is in that email or text message thread. But y'all did great. Y'all know exactly how to find all the red flags for something like a phishing text or email. So now we can move on to our next scam, our next big phone scam, which is spoofing scams. And again, I am positive every single person has experienced this, whether you realize it or not. So spoofing is whenever a scammer uses a software to actually change the number that that comes up on your phone whenever they call. So I can call you from my personal cell phone and I can have it look like 1-800-MEDICARE is calling you. That's how I can have it show up on your phone. Or I can have it show up as a local number to you. So we have people from Maine, from Waxahachie, right? And I am from Houston area. Okay, so of course our area codes are going to be different. Our phone numbers are going to look very different. So I'm going to use this software to change my number to look more like a Maine phone number, like a local Waxahachie phone number. That's what I'm going to do to increase the likelihood that you answer the phone. Okay, but first off, we know for a fact that Medicare, the IRS, Social Security, none of these places are going to call us. Okay, they are never going to give us a phone call. They're not going to text us, right? They're going to send us letters in the mail. Sometimes they may email us if you sign up for email alerts. Okay, but anytime we're getting a phone call from them, we know that that's a scam immediately. The best thing that you can do with scam calls, blocking the number is not going to help you at all. Because if you block my number, I'm just going to change it and call you from a different one, all from the same phone. So blocking numbers is not going to help you. The best thing that you can do is actually something called screening your calls. Okay, and this looks different on every single phone, but there should be a setting in your actual phone, in your general settings, called screening your calls, where whenever a call is coming through that is not in your contact list, it goes straight to voicemail. So then you don't even have to worry with your phone ringing constantly. Because I know I personally get 3, 4, 5 scam calls a day. So this can really help you keep your peace there a little bit. And it's also really helpful if you are a caretaker for someone, maybe with dementia or different cognitive issues that needs access to a phone, but maybe specifically vulnerable to scammers. Okay, so people like to answer the phone and chat with them, and may share information. If you screen their calls so it goes directly to voicemail, if it's not in your contacts, that can really help protect them. Next up, we have grandparent scams, and I've looped this one in with artificial intelligence as well. So what this scam looks like is you get a call in the middle of the night, and it is someone claiming to be a loved one, your child, your grandchild, right? And they're saying, please help me, please help me. I'm on the side of the road. I need money. Please send over $5,000. Don't call the police. Don't call my parents. Just send the money over right now. Okay. And this was very, very big back in the day, right? And then people started to catch on to it of saying, hey, this doesn't sound like my grandchild. No, I'm not called grandma. My grandchild always calls me Gigi. So I know for a fact that this is not my child, or my grandchild. Okay, and then artificial intelligence came in, and they are doing something that's called voice cloning. So, like I said earlier about they're recording our voices on the phone whenever we're chatting with them, when they're recording our voices, they're able to put it into AI, artificial intelligence, and have it mimic our voice and have it say whatever they want it to say. So they could call you in the middle of the night and actually have your child or your grandchild's voice saying, help me, help me. And with the growth of social media, where we are posting everybody and everything online, they now know, the scammer does their research and they know that your grandchild doesn't call you grandma. They call you Gigi. And that's what they have the artificial intelligence voice clone software say when they call you in the middle of the night. This can be really scary because it's hard to differentiate. It's hard to know, especially in a high stress situation. But the best thing that you can do if you are getting that call in the middle of the night, it's urgent, they're asking for money, and it sounds just like your grandchild. One, check on them personally. Okay, reach out to them, call them and say, hey, where are you? Call their phone number. Okay, because they probably will tell you, why are you calling me in the middle of the night? I'm in bed. And also consider having a family code word. Thanksgiving is coming up, Christmas is coming up. Sit down with your loved ones and say, hey, if there's a real emergency, you need me in the middle of the night, you're calling me from a random number, say pineapple. That's how I know that it's actually you, that this is actually legitimate. Okay, because the scammer is not going to know your family code word. So please consider sitting down with your family and doing that this holiday season. And of course, don't send money, don't buy gift cards, don't send cryptocurrency. Sit down, take a second and check in with that family member. Okay. Next up, we have social media scams kind of as a whole. So what this can look like is you're getting that message from somebody saying, hey, do you remember me? We went to high school together. It's been so long. Or with the holidays coming up, you may get added into a Facebook group saying, hey, we're going to do a gift exchange, send in this amount of money and you'll get 10 gifts in return. Or this one is always very popular, romance scams, where you get a message from somebody saying they're Brad Pitt and they want to start a relationship with you, right? Or they're a young model and they're reaching out and they're looking for a sugar daddy, right? Things like that. So these are things that we need to be aware of as we're on social media. And this can happen anywhere, on dating apps, on Facebook, on any sort of social media, Craigslist, anywhere where there is a group of people that can talk to each other online, there could be these scams. And typically what it is it's something called catfishing. I'm sure that y'all are familiar with that term. There was that whole TV show back like 10 years ago of people creating fake profiles and getting caught. But we need to always be suspicious of out of the blue messages, like people just reaching out and saying, hey, I miss you. I would be great to catch up with you sometime. or reaching out asking for money whenever you've never had that sort of relationship or rapport before, right? So if it's somebody from high school that you haven't talked to in 30 years and now they're asking you for money, this is a huge red flag. Also, if you are maybe interested in creating a relationship with somebody that you've met online, this is very popular nowadays. Do your research, ask your friends about them, have your friends look at them and say, hey, does this look suspicious to you? Look on their Facebook profile, right? And see if it was created yesterday, maybe we shouldn't trust this person. Or if they only have 5 friends and one is in Canada, one is in Brazil, and one is from New York, right? Then I'm going to say that this is not a real person, that they don't actually have a centralized friend pool there. And if we're getting any sort of messages from out of the blue, don't respond, just delete them. Okay. Even if it sounds really convincing, if they're saying that they're going to help you get $500 fast, or if they need help, right? And they, maybe they are taking in their grandchildren and they need help paying the light bill. Please, if you could just spare $100, it would really help. Just delete those messages, okay? Do your due diligence, do your research, but do not respond, just delete. Next up, we have money mule scams. So if you have those payment apps on your phone, those money sending apps like Venmo, Cash App, what else? PayPal, any sort of thing like that, you want to be very, very careful, okay? So there is a scam that's going around called the money mule scam. And so what happens is you may get a deposit on one of those money sending apps of $500. And then directly after, you will get a message saying, I am so sorry. I sent that to the wrong person. That's my rent money. Please send it back. Okay. And so what we're going to do is not send it back. We're not going to deposit into our account and go on a shopping spree, right? We are going to have it sit there. We are not going to touch it at all. Okay. Because one of 2 things is going to happen. Either you're going to send it back and the money sending app is going to realize that this is not real money. Okay. They have sent over 500 fake dollars. Maybe it was a bad check. Maybe they're sending it over before the bank realizes it. Okay. But the money sending app will realize that this $500 is not real and they will take it away. Okay. So if you send over $500, you're sending 500 real dollars. So you are going to be out $500 at the end of this. Okay. Or you are helping move stolen money around. They have stolen money. They're sending it to you and trying to get you to send it to a different account to create a very complicated paper trail so that they can take that money and disappear with it. Okay. So if you get something suspicious in your Cash App, Venmo, PayPal, whatever it is, just have it sit there and Venmo will take care of it. Okay. If they really did send it to the wrong person, the money sending app will get it put in the correct place. Okay. Because they can reach out to customer support, or it will realize, like I said, that it's that fake money and will take it away. Okay. So please be wary of this. People ask me, why is this called the money mule scam? Who's the mule? And you are, in this instance, you would be the money mule because you are helping move around stolen or illegitimate funds. So please be wary of this scam if you utilize these apps. And if you do use these apps, if you do use these apps, please consider connecting a credit card to it instead of a bank account or a debit card, because it's a lot easier to get money back if it is stolen on a credit card. Okay, there's a lot more fraud protections on credit cards. I think we are running out of time. Marty, if you could send me a message and let me know how much time I have left, that would be great.
I mean, it is really that time. But
It's that time.
How many more slides do you have?
Well, I'm going to go ahead and skip ahead and say, beware of Medicare scams. That is our bread and butter. Please, if you're receiving free products, free services, this is a scam. Please report that to us. Calls from Medicare, we know, are fake always. It's open enrollment season, so any sort of agents or brokers that are rushing you into a decision, trying to pressure you into joining their plan, please let us know. And Medicare cards are free. You don't have to pay for them. There's no new ones out there. Read your Medicare summary notices and call the Texas Senior Medicare Patrol. Our hotline number is here at 888-341-6187. Please call us if you're seeing anything suspicious in relation to Medicare. That is our whole job, and we are here to help you. Thank you so much. My information is at the back, and I'm so sorry for taking up so much time.
No, you're just fine. You're just fine. With I think we didn't give you all the time, and we were trying to answer questions. So that's just the way it goes. If you have just a minute, I don't know if you do, you may have other commitments. I need to go through the CEU information real quick one more time, and then maybe you could look at the Q&A while I'm doing that. Let me share my screen and get to the CEU here. Share. And then can you all see the CEU slide? Somebody can answer me. I don't know.
Yes, yes, I see it.
Okay, so perfect. So for those of you that are joining us for CEUs today, we're providing CEUs for licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or a license outside of Texas, you're more than welcome to go through the process, get a certificate, and submit it to your jurisdiction. But please note, there's no guarantee they'll take it. I've had people tell me they've been able to use it for both other licenses in Texas and for licenses outside of Texas. But obviously that is very, very specific to whatever license. And so there's no guarantees, but you're more than welcome to get one. We're also giving complimentary certificates of attendance. Those are available. The guidelines to get either one are the same. Today's webinar is worth 1.5 hours of CE credits. You must complete the entire webinar and the Q&A up to about a minute ago, and then and you must complete the Google evaluation survey. That should pop up as you sign out of Zoom today. It should give you a question of, would you like to take a very short survey? It is a very short survey. We appreciate if you would answer that for us, but just note that if you want CEUs or certificates, you must complete that survey. But we do ask everyone to complete it. It helps us in reporting back on the to the funders that help us fund putting on these webinars. The survey link will also be sent out in the follow-up email, along with some of the other links we talked about today that were put in the chat. The Google survey will be available till the 21st to complete it. Give us about a month from then to get those out to you. And yes, I'm probably 6 or 7 weeks behind. I'm not a month at this point because I was out of town for 3 out of the last 5 months with taking care of stuff for my mother, who suddenly ended up in a nursing home. And so I can't, the certificates, I can do a lot of my work when I'm traveling, but certificates are not one of them. I've got to be at my desktop to be able to get those out to you. So so I apologize for that, but we are getting caught up. That's that. And then I'm going to go all the way to the end. I thought I pulled up the wrong one. Hold on. I'm sorry. Well, you're reading the questions because I want to talk about, no, because I overdid it. I went past it. Next month, I'll send out the flyer for next month's presentation as we, with the follow-up email. And I'm trying to pull it up so I can even tell you what it's going to be. It's going to be next month. It's going to be choosing providers and holiday scams. Is going to be next month's presentation. So, did you find anything, Angel?
Yeah, I saw a couple questions, and again, I'm so sorry for going over, but I saw
No, Angel. Angel, it wasn't your fault. It was not your fault. Please don't. Really, go right ahead.
Well, I did see one question asking about receiving these presentations at your facility. You can email me. I put my email in the chat and I can do it again, or you can call the hotline number or my number that was at the end of the presentation. These presentations are completely free. We have multiple presentations and we do them across the entire state. And I'm sure the same is for Leslie and them as well, not across the entire state, but they do provide these presentations, I'm sure.
Yeah,
for
but
different-
there's other area agencies on aging that if you're somewhere, we're in the greater Dallas-Fort Worth area for the area agency on aging, but the number, when you get the follow-up email, there'll be a statewide area agency on aging phone number at the bottom of all the emails I send out. You can call that number and that should be able to help you find someone in your area. If you're not in the greater Dallas-Fort Worth area, they should be able to help you find somebody in your area that gives the Medicare presentations as well. I'm sorry.
And then I saw one more question asking about the vulnerability of landlines, if it's any safer than a mobile phone. And as far as scam calls go, not really. Really and truly, there's not much you can do to stop scam calls if you're on a landline, a mobile, anything that you can receive calls on, there's going to be those same scam calls. So there's not really any added protections choosing a landline over a mobile.
It's so important to let them leave a message. Don't answer it, because when you answer it, you're kind of put on the spot, and that's when they know how to play on your emotions. They know how to really get you where they want you to do what they want you to do. So it's so important just not to answer that phone. If you don't recognize the number, let it go to your voicemail, and you'll find out most of them won't leave messages. And then if it's somebody that wants that that needs to get a hold of you, they're going to leave you a message and say, Marty, I really need to get a hold of you. This is, your mom. and I'll know, and I'll call back my mom's number, not the number they leave me on the phone, exactly. On the message. And make sure it is my mom. And it's really kind of frightening because my mom's been scammed once, a big time, where they got into her bank account and they got her to buy gift cards. They got her to do, and it all was on the same phone call. They kept her on that phone while she was driving from her house to the bank, and from the bank to the drugstore to buy the cards. They kept her on that phone the whole time. And the people on the bank sensed there was something wrong, the people at the bank, because they knew her, and they kept trying to help her. But those people had her so conned, she wouldn't let the people that she knows help her. And it is so frightening, because they get you into this, they hypnotize you almost into this scheme. And they got her to do every single one of the things we talked about today. Yet they got into her bank account, they got into her computer, and they got her to give them, I think it was $1,000 worth of gift cards, and they got them all from her. And the computer, once they hijacked her computer was no good anymore. And then the other thing too is when you're changing computers, make sure someone takes out the hard drive and destroys it.
Yes, completely wipes it.
When you get a new computer, your old computer, get someone to take out the hard drive. That's where all the information is stored. Your bank account, login numbers, your social security number, everything. They should take it out and they should smash it with a sledgehammer so no one can ever recognize that it was a computer chip either. Sorry, I'm just...
No, yes.
I know we're past time. So, Leslie, did you have anything else? I'm sorry, I'm taking up both of yours.
No, it was great information. No, I'm good here. Wait, where's my video? You can hear me, can't you?
Yep.
Why isn't my video turning on?
I
There it
don't
is. There it is. Okay. No, it was great information, and we are always available for presentations as well.
Yeah.
And yeah.
Great. Um, so you all, I will have contact information for both Leslie and Angel. Will be in the follow-up email. You know, we've talked about the links to the two books. And if you want the link to the
Video.
the video, the humorous video that I won't send out in the follow-up email, but I'll have it here and be happy to send you that link if you request it. But just know you requested at your own risk, whatever you're watching. But it's not a scam. It's just that it may not be something that everyone might find appropriate, I guess is what you're saying, Leslie. Is that right?
Yeah. Not safe for work.
Yeah, that's right. That's right. Some of it might have a little color to it, I guess you would say.
Ooh.
Is that right? So okay, but thank you, Angel. Thank you, Leslie. Thank you, Simon. There in the background. Thank you very, very much. We certainly appreciate it. It was great information, and happy open enrollment to you all.
Ooh, thanks.
Thanks,
Good luck.
Back to work we
You know,
go. So
you would think that they would end open enrollment before Thanksgiving so you could be thankful. They don't. They do it after Thanksgiving.
oh no, it's good because everybody getting together for Thanksgiving can talk about all their plans and then call us. So
Yeah, and they call us. But no, you only have until the 6th of December, right?
the 7th.
Or the
Yeah.
7th of December for Medicare. Now there's
Right.
other open enrollments going on now because I know I have my medical is on the
Marketplace.
marketplace, yes, and that open enrollment is going on now. But when does that end? Do you know?
I don't know.
I don't know. That's right. That's right. That's a whole different thing.
Yeah.
It started October 1st, and it's going on as we speak now. So
Yeah.
very good. Y'all have a great Thanksgiving. Please, please, please don't get scammed and help your family members understand all this stuff. We'll have this recording on our YouTube channel. You can have them watch it if you'd like to. But whatever you can do to help keep them and yourselves from getting scammed. Again, Simon, Leslie, Angel, thank you so much.
Thank you. It was great to be
Aw.
here.
Thank you.
Thank
Bye.
you.
Happy Thanksgiving, everyone.
All
You too.
right. You
Y'all
too. Thank
have a
you.
wonderful day. Take care.